Hello, everybody. I'm here today with Danise Seaters, who is Director of Advanced Practice Education and Fellowships here at UC Davis Health. I wanted to have her share some information about this pioneering program that she's leading. She has a background as a critical care and emergency medicine nurse practitioner. She has an acute care nurse practitioner certification like I do. Welcome, Danise.
Thank you, Lars, and thank you for inviting me to speak today on our fellowship programs. We are very proud at UC Davis Health of our advanced practice fellowship programs. We currently have a program that has 8 tracks in specialty care that's targeted at taking new graduate nurse practitioners and physician assistants. And within that first 18 months after graduation, having them begin a fellowship program that really works on developing their skills as they transition to practice in specialty care. Our program is specifically targeted at specialty care, specifically that these providers typically would not find initial employment right out of school in these specific areas. So we've created programs, curriculum, didactic education, really to support a new graduate as they come into that specialty service. Right now, we currently have burn surgery, oncology, orthopedics, neurology, neurosurgery, inpatient glycemic team, endocrinology, radiology, trauma surgery. We have 8 specialty programs that are individualized curriculum that we've developed. We use an advisory board that oversees our fellowship programs and the development of each track. So it's a collaborative opportunity for our leadership throughout the health system to develop these programs. Our fellowship graduates have been very successful on a return on investment. We've been able to retain 81% of them to date of our graduated fellows into full-time employment here at UC Davis Health, which is really this proof of concept that we could take a fellowship program and we could use it as a return on investment, train people in a very specialized skill area, and then retain them for full-time employment. We've created a qualified pipeline of providers that come through the fellowship that can support the specialty areas and the care that we're delivering here at UC Davis Health. This is a program we develop, as I mentioned, educational content. We have recently received accreditation from the Consortium of Advanced Practice. Accreditation was part of our journey and part of how we set up our fellowship programs from the very beginning stages, really looking at having good program support, education, content, and practice experiences to really develop those new learners as they came into our programs.
Great, thank you so much. As a graduate of the first class of the program in trauma surgery, I'm very proud of what we're doing here. Could you say just a few words about national trends, your impression of the role of fellowships or residencies in the US for NPs?
Yeah, so we are seeing national trends in residencies and fellowships, interchangeable terms based on different locations and hospital staffing. We chose to use fellowship for our program here based on residents in an academic setting are not finished with their training yet or licensed, and our fellows are licensed and privileged as independent providers here. So we chose to use the term fellowship for our program. You will see national trends of fellowships popping up across our nation, specifically lots of different various areas that can be specialty care. They can also be in primary care. Couple of things you may notice, there's differences in programs based on some programs will have one content, like one area that they focus in and they have multiple learners. And others are similar to our program where we have various different programs in different specialty areas with one or a few learners that are, or a few fellows that are in each of those programs. So there's different ways of developing fellowship or transition to practice programs. We are seeing with the increased presence of fellowship programs throughout the United States, that was our opportunity to look at our program structure and to select accreditation and to seek accreditation for our program, to look at our standards and to make sure that we had a high rigor and the value that we had in our program to validate that with accreditation standards.
Great. There is also a primary care residency program affiliated with us here over at the Nurse Practitioners at UC Davis. So I think they have about 10 primary care residents each year that also go through and practice in a primary care clinic and similarly get that mentoring during their first year of practice. They already have the authority to prescribe medications, to diagnose, etc., but they have a strong supporter or mentor that guides them through that year. Speaking of mentoring, can you just mention a couple of words about what we offer to our already experienced nurse practitioners and PAs who work in the system here regarding continuing education, mentoring, etc.
Absolutely. So interestingly enough, some of the things we developed for our fellowship program and to support those fellows that were in our program have now been expanded throughout our whole advanced practice community. Mentorship is one of those areas. We started out with having a mentorship program, partnering our current fellowship um, fellow with a prior graduate to mentor them through that 1 year transition. That program showed value and a large amount of success. We have now created a structure that has implemented advanced practice mentoring throughout our health system, looking at all of our providers in the inpatient as well as ambulatory settings and how we can find ways to partner and mentor. This is in collaboration as well with the School of Nursing and different leaders in education there. Our NP residency program is primary care focused, and we have our APP fellowship program, which is our specialty program, that are basically sister programs, but obviously in different specialty areas. Both of our programs there offer mentoring to all of our program graduates as well as to the program attendees during their fellowship or residency time. And so we really work to focus on the professional development of our advanced practice team. And so that was that expansion from not just the fellowship and residency program having a dedicated mentoring program, but expanding that into the health system, partnering where once a year we accept applications and then we partner mentors and mentees based off of interest. We have, I think, 6 or 7 different tracks in our mentoring program, looking at some seeking education, doctoral degrees, some of them that are new graduates, leadership tracks. So various different tracks where people can identify where they're looking for mentoring. We also have a new concept of reverse mentoring that is coming, that is looking at leadership staff that have been in different roles or providers that have been in roles for prolonged time periods, looking at our newer generation and having them be the mentors to us so that we can learn about that new workforce coming in and find ways that we can continue to adapt and really be inclusive of that.
And some of the other resources that you oversee that I appreciate in our system here is things like grand rounds monthly for our advanced practice providers, our annual symposium where we have national guests come in, etc. So there's a really wonderful effort and focus on developing our advanced practice workforce, which I think is important for retention and the happiness of our staff here.
Yeah, we always want to be open to what staff, the workforce is interested in, right? We've polled or surveyed our staff. We've also developed advanced practice journal club, which is something that we look quarterly at, that we do sessions of scholarly literature review so that we can build the skill set of that. We have monthly advanced practice grand rounds. We do a publication series where we partner with our Center for Nursing Science, really to give people who are interested in publications, grant writing, abstracts, presenting at conferences or publishing or doing research, we want them to have resources. So we've created educational series that are with the Center for Nursing Science too, to really develop the interest in publications and scholarly work.
And speaking of mentoring, I think an important role also for our experienced nurse practitioners in the hospital is mentoring the new physicians who come in as first-year interns and residents. There's a really collaborative learning environment that I've seen on several specialty services where I work, where our NPs really are a great educational resource for any new provider that enters the system.
Absolutely. Our teams are multidisciplinary teams. We're team-based care model for delivering the care that we do even on specialty care services. And we have advanced practice providers that stay on those teams, and they may be the consistent provider from day to day on a more consistent basis than rotating learners that come through. And so really they are a resource and an advocate for our physician colleagues and counterparts that are rotating through different various parts of their academic journey.
All right, thank you so much, Danise, for joining me for this brief presentation on our great educational resources here at UC Davis. I'm just very proud of what's growing here, and thank you for your leadership in that area.
Thank you, Lars. Thank you for this opportunity. Have a great day.